Welcome, everyone, to our Lenox Hill and Northwell Building Bridges to the Community lecture series. We are excited tonight to have with us Dr. Supriti Bahoria, who is the Director of Nuclear Cardiology at Staten Island University Hospital. She is an expert in prevention and women's heart disease. And tonight she'll be covering the topic of prevention of heart disease in women as we get ready for Heart Month in February. We are really excited to have you here tonight, Dr. Bahoria, and you can get started. Thank you.
Thank you so much, Dr. Gianos. It's really a pleasure to be here today, where I'm actually going to talk about the two things I'm passionate about the most, which is prevention of heart disease and women's heart health. So with that, I'll get started. I have no relevant disclosures to this talk. So the objectives of this talk are to first discuss the importance of heart disease in women. As Dr. Giano said, this is such an important topic, but it doesn't get as much importance as it deserves. And then we're going to highlight the traditional as well as sex-specific risk factors of heart disease in women. And then we're going to talk about ways and strategies to prevent heart disease, focusing on a heart-healthy lifestyle. So the outline of my talk is we'll first introduce the subject, we'll talk about heart disease in women, we'll talk about risk factors, we'll talk about strategies for a heart-healthy lifestyle, and then I just want to introduce the concept of cardiac wellness and how it pertains to you. So I always like to start my talks by giving you some statistics, not to scare anybody, but to raise awareness of heart disease and its importance. So cardiovascular disease is the #1 killer of women worldwide. And overall, 1 in 3 women die of cardiovascular disease. Cardiovascular disease kills more women than all the cancers combined, including breast cancer. So it's extremely important. The good news is that no matter your risk factors, 80% of heart disease is preventable. So for years, women have been underrepresented in cardiovascular disease trials. And this is an excerpt from Dr. Bernadine Healy, who's one of the pioneers of heart disease. And she wrote this more than 3 decades ago in the New England Journal of Medicine. So Dr. Healy used the term Yentl syndrome to describe the historical price that women have had to pay for being different from men in healthcare, and specifically in terms of cardiovascular care. The heroine of Isaac Bashevis Singer's short story had to disguise herself as a man to attend school and study the Talmud. Being just like a man has historically been a price women have had to pay for equality. Being different from men has meant being second class and less than equal for most of recorded time, and the same is for cardiovascular disease. Dr. Healy noted that in cardiovascular disease, women were second-class citizens in terms of equality of treatment and outcomes of the disease that was most likely to kill them. She also noted and coined another term along with Dr. Nanette Wenger, who's also one of the pioneers for heart disease, called bikini medicine, where when women went to the doctor's office, the organs that were behind the bikini were the ones that were concentrated on. So the breasts and the reproductive organs, and the rest of the woman was kind of left out. And unfortunately, this is even true in some places today. But this awareness and these women who have pioneered heart disease have led to the American Heart Association, the American College of Cardiology, formulating things like Go Red for Women, and driven the cardiovascular community to implement changes in the way we recognize and treat heart disease in women. So just to talk about, there are different risk factors for cardiovascular disease that are unique to women. Women have different ways that they manifest their cardiovascular disease. There are sex differences in the responses to risk factors and treatments. And it's important for all of us to get together and raise awareness about women's heart health. And that's how we'll strive towards prevention of heart disease in women. So I really want to talk about the risk factors for heart disease because there's traditional risk factors and there are female-specific risk factors. We'll focus, of course, on the female-specific risk factors because that's the nature of this talk, but the traditional risk factors are important as well. And these are smoking, high blood pressure, high cholesterol, diabetes, being sedentary, which in our recent literature has been shown to be even more of a risk factor for heart disease than smoking, eating an unhealthy diet, obesity, a family history of heart disease, and older age. Now, these are the traditional risk factors. So now let's look at the sex-specific risk factors. So we can go through this nice timeline that we have here. So the female-specific risk factors are if you have early age of onset of your period, if you are diagnosed with something called polycystic ovarian syndrome, where you have a lot of cysts in your ovaries, using OCPs or birth control, and menopause before the age of 40. Then when a woman is pregnant, the health problems that women can have during pregnancy are risk factors for heart disease in the future. These are gestational diabetes, so diabetes in your pregnancy, high blood pressure in your pregnancy, preeclampsia, which occurs in a lot more pregnancies than we realize, and preterm birth. And then at the end of the spectrum in older women, menopause and hormone replacement therapy, which we'll talk about a little bit more as we go through the talk. So the pregnancy-associated conditions that we talked about, like the gestational diabetes, the gestational hypertension, preeclampsia, these are called adverse pregnancy outcomes, or APOs. And APOs are actually happening in about 10 to 20% of all pregnancies. And they do increase the risk of cardiovascular disease in a woman's future life 1.8 to 4-fold. And I don't know if you've all read a lot in the media that actually the United States is one of the only developing countries where the rate of maternal mortality is increasing. And this is from cardiovascular issues that come up. So it's very important for us to talk about this. Also, if women have pregnancy losses or miscarriages, that can also increase their risk of heart disease in the future, up to twice as much as women who don't have miscarriages. And now let's talk a little bit about menopause, which does not itself increase the risk of cardiovascular disease in the future. However, the physiological changes that occur in a woman's body during menopause can increase the risk of cardiovascular disease. So what is menopause? Menopause is mostly about estrogen withdrawal. And when that happens, there are changes in the distribution of body fat. There's a reduction in glucose tolerance that can lead to diabetes. There's high blood pressure. There can be a change in your cholesterol blood work, so you can get high cholesterol and things like this. And even because of all of these things that happen during menopause, premature menopause was actually considered a risk-enhancing factor for heart disease in the 2018 cholesterol guidelines. So I just want to touch on the traditional risk factors as well, because these are very important and these happen in women and in men, but the traditional risk factors do lead to heart disease in the future. So it's important for us to discuss them. So traditional risk factors are high blood pressure. So high blood pressure is blood pressure that is more than 130/80. And if we keep your blood pressure less than 130/80, it decreases your risk of heart attack and stroke by more than 50%. So blood pressure is a very important risk factor for heart disease. It's very important to get your blood pressure checked whenever you see the doctor. And if you do see that your blood pressure is elevated, get a blood pressure cuff. Check your blood pressure at home. It's important to always check your blood pressure correctly. And there's a nice algorithm that we have over here, a flow chart on how to check your blood pressure at home. I'll go over it quickly because a lot of my patients talk to me about this, and we really get varying numbers if the blood pressure isn't checked correctly. So what you're supposed to do is have your feet firmly planted on the ground, not talk for 5 minutes, don't drink any coffee or eat anything for about 30 minutes before you take your blood pressure. Try and sit calmly and relax for 5 minutes. Use a cuff that's a proper size. If you're confused about that, you can always talk to your doctor and have them help you size your cuff, and then check your blood pressure. You can keep a log and come with that to your doctor's visits, and that's very helpful for your doctor as well. The next thing I want to talk about is high cholesterol. So what is cholesterol? Cholesterol is basically a fat-like substance that clogs up your arteries and makes heart attacks and strokes more likely. So there's good cholesterol and there's bad cholesterol. And the cholesterol is basically what we check when we check our lipid panel on our blood work. So cholesterol is what builds up in our arteries and causes heart attacks. So it's very important that we control our cholesterol, and that we do with diet and exercise and medications as well. The next thing is diabetes. So diabetes happens when your body cannot process sugar properly into energy and your cells don't respond to insulin. Diabetes is unfortunately a very common diagnosis, and more than 30 million adults in the United States have diabetes. So we talked a little bit about the traditional risk factors, the sex-specific risk factors for heart disease. Now I just want to go through the symptoms of heart disease a little bit, because this is what is really important and is a lot of the times what brings somebody to the doctor. So men and women can have different symptoms for heart disease. Chest pain is the most common symptom for men and women, but women can also get shortness of breath. They can get discomfort in their arms or their neck. They can have feelings of heartburn. They can have intense fatigue, out of the ordinary, dizziness, nausea, and vomiting, and then burst into cold sweats. So if you have these symptoms or these constellation of symptoms, it's very important that you seek medical care immediately. If you do have these symptoms and you do come to the doctor, then there's different ways for us to treat it. The first thing, and that's what we've been talking about a lot, are the lifestyle modifications, and we'll go into that even more detail in the talk. And then we have a slew of medications to choose from, and also procedures that we can do to help take care of your heart. This is an example of what we see on the screen when we do a cardiac catheterization, also known as an angiogram. For example, if somebody comes in with chest pain and we see that they may be having a heart attack, we take them to our laboratory and do this procedure. Over here, you can see this is one of the arteries of the heart. This is a blockage in that artery, and then this is the picture that we get after we put a stent into the artery. And you can see that there's beautiful blood flow in the artery now, whereas it was blocked earlier. So this is just one of the many procedures and treatments that we have for heart disease. And it's really wonderful how much cardiology as a field has advanced in today's day and age, and I'm really honored and proud to be a part of this field. Okay, so let's kind of take a step back. So far, we've talked about our risk factors for heart disease. We've talked a little bit about symptoms. We've talked about some of the procedures that we can do to take care of your heart. But I think the most important thing for us to say so far is that prevention is really important. And it's very important for us all to work together as a team to achieve cardiac wellness. So now I'm going to talk about cardiac wellness as a concept. And so what is wellness? So the Global Wellness Institute defines wellness as the active pursuit of activities, choices, and lifestyles that leads to a state of holistic health. So you can see here with wellness right in the middle, it comes from physical, mental, spiritual, environmental, social, and emotional wellness. So all of these come together to lead to overall wellness. And wellness is important in terms of your whole body and for your heart as well. So cardiac wellness itself starts with heart healthy habits. So these are diet, exercise, and mental health. There was a big survey that was done by the Wellness Institute in the United States, and it actually showed that 1 in 4 women are dissatisfied with their overall wellness. So I want you to kind of take a moment to think about your own cardiac wellness and see whether you're satisfied with that and whether you still think that there are ways we can work together to help improve your cardiac wellness. So let's talk about diet, which is the most important. So the diet that has been shown in our data to really help with your overall heart health and your cardiovascular mortality is the Mediterranean diet. So adherence with this diet, the Mediterranean diet, leads to better heart outcomes. So this is kind of the Mediterranean diet pyramid that we have here. So when you talk about the Mediterranean diet, think about what people usually eat off the coast of the Mediterranean. So there's a lot of green leafy vegetables, there's olive oil for cooking, there's a lot of legumes and beans, there's fresh fatty fish. A big part of this diet is to cut down the red meat and the sweets and to really eat whole grains and less processed food. Another part of this is exercise, and we'll talk about that as well. So the American Heart Association says that we should all try and get 30 minutes of moderate intensity activity 5 times a week. So moderate intensity activity isn't running a marathon. It's also not a leisurely walk on the boardwalk. It's moderate intensity. So you have to feel that your heart rate is getting up, a brisk walk, maybe a brisk bike ride. Swimming is a great activity for your heart. As women grow older, especially, we should incorporate weight training into our exercise regimens, and that is overall good for women's heart health. So that's a little bit about exercise. And sometimes it might be hard to incorporate exercise into our busy lifestyles. And there's many things you can do to try and incorporate it. You don't need to do the 30 minutes all at once. You can do 2 15-minute intervals. You can work with your colleagues or your friends and set up a group that exercises together. All of these things are methods that can help you get the exercise that you need that's good for your heart. Okay, then something that's very important that we don't talk about enough is also mental health. So cardiovascular disease and depression are very, very linked and currently represent the most common cause of disability in high-income countries. All of us have stressful lives, and stress, anxiety, depression, they may lead to behaviors that are not heart healthy. As we can kind of think about our day-to-day lives, when we have a stressful day at work, it's a little bit more difficult to come back home and go to the gym or go for a bike ride. Similarly, when we have a good day at work, we have a lot more energy and we can go for an exercise, we can make a nice healthy meal at home. So it's kind of a vicious cycle where mental health is concerned sometimes. And it's important to get the health we need to kind of break that cycle so we're going towards overall heart health. Another important thing to note is that depression has been shown to be very common in post-heart attack symptoms. So when I have patients coming to me in my office after a heart attack, I always ask them about their mood, because depression is very common in post-heart attack symptoms, and we need to be able to treat that in order to help their recovery after a heart attack. So basically, in terms of mental health, it's important to recognize when you need help and seek help and get your community involved to help improve your mental health. And this will help your heart health overall as well. Okay, so let's talk a little bit about smoking. I just want to start off by saying that the best thing that you can do for your heart if you smoke is to quit smoking. Within 1 year of smoking, your risk of a heart attack decreases dramatically. What smoking does is that it increases the formation of that bad stuff, that cholesterol in your blood vessels, and these can break off and cause heart attacks and strokes. According to the 2014 Surgeon General's report on smoking and health, smoking is a major cause of cardiovascular disease, and it causes approximately 1 of every 4 deaths from cardiovascular disease. So if you do smoke, it's never too late to stop smoking. And if there's many ways that you can seek help to stop smoking. We have nicotine replacement therapy, medications. So when you are ready to stop smoking, reach out to your doctor for help to stop smoking. I want to talk to you about a couple of ways that we can strengthen our mind-body connection as well, and that also leads to overall improvement in our heart health. The first one is yoga, and the second one is meditation. So these are important because, as we talked about stress earlier and mental health, all of us have stressful lives, but it's very important that that the stress that we take doesn't come to our heart, right? So we have to strengthen our mind-body connection so that we can improve our overall cardiac wellness. So one of the ways we can do that is by yoga. So yoga has been shown in our data to reduce stress. It even decreases your cholesterol and it reduces blood pressure. Yoga has a combination of physical and mental well-being. It's breathing, it's stretching. It is really a great technique to strengthen that mind-body connection and improve your overall cardiac wellness. The second thing is meditation. And meditation, if you're a beginner or you've never done it before, can be a little bit intimidating, but I recommend these 2 apps to my patients that are not necessarily like hardcore meditation or anything like that, but breathing exercises and learning how to breathe and calm yourself. One of those apps is called Calm, and the other one is Headspace, and they have great beginner exercises on breathing, more advanced meditations. They really help you to sleep, to get better sleep, and overall will help with cardiac wellness. So I just wanted to talk about my approach to women's heart health overall. And this kind of brings together everything in our talk. So step 1, when I think about the sex-specific risk factors for heart disease for women, then as we talked about, if you have had your period earlier than was expected, if your period started, if you had ever been diagnosed with polycystic ovarian syndrome, using over-the-counter contraceptives, recurrent pregnancy losses, the gestational diabetes, gestational high blood pressure, problems in the pregnancy, and then the next step is talking about the sex-specific risk factors that are present. If they are present, then to assess for the traditional risk factors as well. So the traditional risk factors that we kind of talked about were high blood pressure, diabetes, and high cholesterol. And if these are present as well, we have to really begin aggressive risk factor management, and we have to implement the best techniques for cardiac wellness. So the American Heart Association has Life Simple 7, that it's actually Life Simple 8 now, but manage your blood pressure, control your cholesterol, reduce the blood sugar, stay active, eat healthy, lose weight, and stop smoking. So the last step is that using all of these risk factors, then you estimate somebody's 10-year risk of heart disease, and you treat it based on the percentage of low, intermediate, or high risk. So this is kind of my approach to women's heart health. And a lot of doctors that you see that focus on women's heart health and prevention of heart disease use a similar kind of approach to assess your risk and to treat you and take care of your heart in the best possible way. So just to summarize, we really talked a lot about heart disease in women, and I want to stress on everything that you can do to be your own heart hero. So educate yourself about risk factors for heart disease. A great first step was listening to this talk today. Empower yourself to get screened every year. Go to your doctor, ask good questions, get your blood work done. If you do have symptoms, don't ignore your symptoms. We talked a little bit about the symptoms of heart disease. Prioritize your heart health. A lot of women do not prioritize their own health. Women are worried about everybody around them, but you are important. Your heart health is also important. And these are the ways that you can come together and be your own heart hero. Thank you very much for your attention. Are there any questions?
Thank you so much, Dr. Bahuria. I'd like to first welcome everyone again. This is our Lenox Hill Northwell Building Bridges series, and our talk tonight was prevention of heart disease in women. And Dr. Bahuria really covered that quite extensively over both the preventive aspects, the clinical aspects. So a couple of quick questions that come to mind. What are the specific syndromes in women that perhaps, I know we always hear about heart disease in women. Is that just regular heart disease, or are there specific things that we need to be aware of?
Sure, Dr. Gianos, that's a great question. There are specific syndromes that manifest in women more than they manifest in men. For example, women who have had breast cancer, they've been treated with chemo and radiation, and in their lifetime, we get to see more heart disease in them based on those treatments. So women with breast cancer should definitely be seeing a cardiologist, at least for initial preventative care. Another phenomena that we see is called microvascular disease. So microvascular disease are the little arteries and blood vessels in the heart, and they have a change in oxygen and blood supply that causes chest pain, and we see that more in women. Another thing that comes to mind is something called SCAD, or spontaneous coronary artery dissection. This is when the wall of the artery of the heart can tear because of pressure, and it can manifest as a heart attack. And sometimes it's scary because we see this in pregnant women as well. So these are kind of some specific things that we can see in women more than men.
Wonderful. Yeah, and that's really important to recognize. I think people don't realize that, yes, the most common thing that women have is regular heart disease, sort of plaque in the arteries and things like that. But there is also a unique subset of disorders that, experts out there are perhaps more attuned to. So really important why you would see somebody. And why would you see specifically a women heart doctor? Is it important to sort of seek someone out, or there who needs just a regular internist, maybe a cardiologist, women heart, et cetera?
So it's never wrong to seek preventative care for your heart, but I would say certainly a women's specialist if you have had any of those women-specific risk factors. For example, problems in the pregnancy, like gestational diabetes or preeclampsia. Also, if you are having issues with menopause, like symptoms that are coming on after menopause, it might be a good idea to see a women's heart specialist. And then in terms of seeing a preventative cardiologist, if you have risk factors, especially if you have a family history of heart disease, like people having heart attacks young in your family, it's never a bad idea to see a preventative cardiologist.
Excellent. That's really, really good advice. Great. So in terms of what you've covered, the pregnancy things are very, very important, and I think now getting recognized. So in terms of women getting pregnant, let's say there's a woman planning a pregnancy and whatnot, are there ways to go about that to assure sort of heart health during the pregnancy and whatnot?
Definitely. So I think the most important thing is to concentrate on your own wellness when you're trying to get pregnant and when you're pregnant as well. A lot of the times women get pregnant and are just focused on the baby, but their health matters as well. So when women are trying to get pregnant, it's important to maintain a heart healthy lifestyle, eat a heart healthy Mediterranean diet. These days we're saying more and more plant-based. I know that that's hard to do, but that's really good for your heart as well. Exercise regularly. That's very good for your heart, and that keeps you going during the pregnancy. Also, I found that a lot of women say that yoga really helps during pregnancy with the breathing and the stretching. It helps with the symptoms that you can sometimes get, like palpitation, shortness of breath. So those are some tips that I would give.
Wonderful. Yeah, and that really makes a difference. It's amazing how a pregnancy outcome, both for the mom and how well she does, long term, and also the baby. There's really a difference when you do target those things well in advance of the pregnancy. So great. So pregnancy is a huge time to focus on. What about menopause? You talked a little bit about all the changes that happen during menopause. Should women think about hormone replacement therapy? I know there's a lot of controversy there. What are your thoughts on that?
So hormone replacement therapy, I would just overall say that it's a very individualized decision. For years, I think even as cardiologists, we've kind of been saying like no to hormone replacement therapy, but I think there's a lot more data to show that in certain women, especially if they have awful risk factors of menopause, if they don't have risk factors that are concerning for cardiovascular disease, it's certainly a discussion to have with their doctor, and hormone replacement therapy can be on the table.
Excellent. Yes, I think you're 100% right. We were, when I was an early attending, I remember everyone would say just never, never prescribe it to a woman, just because of some early data that was out that truthfully, it wasn't exactly analyzed, I think, to appreciate the fact that not all women do badly with hormone therapy. That was what the general conclusion was. And now we know a little bit better. And I think now we're going to have more and more research, hopefully, to answer that question even better in the future. And I think things will change tremendously. Excellent. And great. And yeah, I think the aspects of wellness that you focus on, mental health, people always think these are secondary things, I think, exercise, nutrition, but they're actually at the core, and perhaps even more so in women, women being caregivers and, sort of managing a lot of stressful situations. I think it's almost more important in women that we have that kind of focus. I'm so glad you highlighted that.
Absolutely. As all of us, I think, tell our patients that, prevention is the key, and 80% of heart disease is preventable. So it's never too early to start focusing on cardiac wellness.
That's right. Exactly. Good. And along those lines, when it comes to women's heart disease, there are centers out there who are expert in that. In our Northwell Health System, we have ones throughout our health system. And Dr. Bahuria is seeing patients in Staten Island. We partner with an organization called the Women Heart Organization. And it's a great organization where women who had heart disease, are living with heart disease, become champions for the disease. And then they educate other women, they hold sessions, support groups, various things. And one of our wonderful champions for heart disease, Agnes Chakluski, is on the call tonight. And she just reminds me that, and I know her, since COVID, a lot of the sessions have become virtual. They just transitioned to that. And she's done a great job at wanting to now, since it is virtual, why not expand it even more broadly? So sort of a reminder that they would love to have the Staten Island patients joining their meetings. So Agnes, feel free to share in the, actually, I don't know if it's possible to share it on this in the chat, actually, but we can definitely share the information when we send out the emails about this so that people know how they can join those meetings, because they're wonderful. I mean, it's both educational, learning about the heart disease, but it's also support. It's someone who's been through this, who is walking you through what to expect, how to manage it emotionally, how to deal with a lot of these things. So, I think it's a wonderful organization, and thank you for reminding us of that,
Yeah,
Agnes.
definitely will share it with our Staten Island patients as well.
Wonderful. Yes. It's been very, very well attended in Manhattan. So yes, absolutely. And she is going to share with me the schedule for 2024. So, it's a monthly meeting, and they plan in advance what the topics are going to be. So at least you have the date of when those meetings are when she shares that in our email, and I'll share it with the group who gets this email. This way people can know to attend and everything. And if they need anything, she also, can provide the phone number to just get in touch, even if it's just for a call or whatnot. So great.
Great, thanks.
Excellent. Yes, thank you so much for joining us tonight. We really, really appreciate it. Your expertise is wonderful, and Staten Island is lucky to have you. And thank you to our audience for joining us. We'll be coming back to you next month for Heart Month. February is Heart Month, just a reminder. So, thinking about healthy behaviors and making sure to raise awareness about heart disease in general, and specifically women's heart disease as well. So thank you so much.
Thank you so much. Good night, everyone.
Take care.